Types of cancer, a comprehensive overview. Cancer, a term that strikes fear and apprehension, refers to a group of diseases characterized by the uncontrolled growth and spread of abnormal cells. As per the latest data available, there are more than 100 different types of cancer, each categorized by the type of cell initially affected. This article presents a comprehensive overview of several of these types, from the most common to those less frequently encountered. Breast cancer. Breast cancer is the most common cancer in women worldwide. It begins when the cells in the breast start to grow out of control, forming a tumor that can often be seen on an X-ray or felt as a lump. There are several types of breast cancer, the most common being ductal carcinoma, originating from the ducts, and lobular carcinoma, originating from the lobules. Lung cancer. Lung cancer, one of the leading causes of cancer-related deaths, mainly results from smoking, although non-smokers can also develop it. It's divided into two main types, small cell lung cancer and non-small cell lung cancer, the latter being more common. Prostate cancer. Prostate cancer is the most common cancer in men, particularly in developed countries. It develops in the prostate, a small gland producing seminal fluid in men. It generally grows slowly, and many men with this type of cancer are asymptomatic in the early stages. Colorectal cancer. This type of cancer affects the colon or rectum, which make up the large intestine. Colorectal cancer often begins as a polyp or small growth on the lining of the colon or rectum, which can develop into cancer over time. Skin cancer. Skin cancer, including melanoma, basal cell, and squamous cell carcinoma, is one of the most common forms of cancer globally. Exposure to ultraviolet, UV, radiation from the sun or tanning beds is the primary cause. Leukemia. This cancer affects the body's blood-forming tissues, including the bone marrow and the lymphatic system. There are several types of leukemia, categorized as either acute, fast-growing, or chronic, slow-growing. Lymphoma. Lymphomas are cancers of the lymphatic system. The two main types are Hodgkin lymphoma, HL, and non-Hodgkin lymphoma, NHL. HL is characterized by the presence of Reed-Sternberg cells, while NHL types are quite diverse. Kidney cancer. Renal cell carcinoma, the most common type of kidney cancer, usually affects adults. A less common type is Wilms tumor, which primarily affects children. Ovarian cancer. This type of cancer begins in the ovaries. While quite rare, ovarian cancer causes more deaths than any other cancer of the female reproductive system, primarily because it's often diagnosed at a late stage. Pancreatic cancer. This cancer starts in the tissues of the pancreas, an organ in the abdomen. Pancreatic cancer typically spreads rapidly and is seldom detected in its early stages, which contributes to its high mortality rate. Liver cancer. Liver cancer happens when normal cells in the liver become abnormal in appearance and behavior. The cancer cells can form a mass called a tumor, spread to other parts of the liver, or spread to other organs within the body. It's crucial to note that having risk factors for these cancers does not guarantee their development, and lacking risk factors does not ensure their prevention. Many factors contribute to the development of cancer, including genetics, environmental exposure, lifestyle choices, and more. Understanding these types of cancer, their signs and symptoms, and potential risk factors can empower individuals to make informed decisions about their health and wellness. Bladder cancer. Bladder cancer commonly begins in the cells lining the bladder, the organ that stores urine. The most common type is transitional cell carcinoma, also known as urothelial carcinoma. Smokers are at a higher risk of bladder cancer than non-smokers. Stomach cancer, also known as gastric cancer, this type starts in the mucus-producing cells that line the stomach. It is often diagnosed at an advanced stage because it rarely causes symptoms in the early stages. Brain and other nervous system cancers. These include many different types of cancer that can occur in various parts of the brain and spinal cord. Gliomas, which begin in the brain or spinal cord, are the most common type. Testicular cancer. Although testicular cancer is less common than other types, its incidence has been increasing over the past few decades. It typically affects younger men and is highly treatable, even when it has spread beyond the testicle. Thyroid cancer. Thyroid cancer occurs in the cells of the thyroid, a butterfly-shaped gland at the base of the neck. Different types of thyroid cancer exist, including papillary, follicular, medullary, and anaplastic thyroid cancer. Multiple myeloma. This cancer affects plasma cells, a type of white blood cell responsible for producing antibodies. In multiple myeloma, cancerous plasma cells accumulate in the bone marrow and produce abnormal antibodies that can cause various problems. Cervical cancer. Cervical cancer begins in the cells lining the cervix, the lower part of the uterus. Most cases of cervical cancer are caused by infection with certain types of human papillomavirus, HPV, which can be prevented through vaccination. Endometrial cancer. This cancer begins in the lining of the uterus, called the endometrium. It is most commonly diagnosed in women who have undergone menopause. Oral cancer. This encompasses cancers of the lips, tongue, cheeks, floor of the mouth, hard and soft palate, sinuses, and pharynx. Oral cancer can be life-threatening if not diagnosed and treated early. Cancer is indeed a complex and multifaceted disease, with numerous types and subtypes. However, early detection, improving treatment methods, and preventive measures such as healthy lifestyle changes and vaccinations for certain types of cancer are all helping to reduce the global cancer burden. Regular screenings and self-examinations can aid in early detection, and individuals should always seek medical advice if they have any concerns. Remember, the better informed we are, the better equipped we are to promote health and prevent disease.